government should be the vehicle or the platform to do all of that. I know President Obama has been a community organizer, but our definition of community doesn't need to be and shouldn't be the federal government. There are great acts of love and kindness that we can do on an individual level through our affiliations and associations, through our places of worship, through communities, through neighborly acts of kindness and gestures, and many, many other examples. I think it's quite presumptuous to say that the biblical answer to things is the federal government. There are many ways to express love and kindness and support for fellow citizens, and we're all called to do that.
Let me ask you about these death panels, or these so-called death panels. You know, the Obama administration has been very forceful in this, saying, look, it's just not true. There have been other fact-check organizations that have debunked this idea of death panels, and yet Sarah Palin has said this, and she said it again today in the Wall Street Journal op-ed. I mean, are you on the same page as your Republican friend?
Well, I think the concern is if you look at the rhetoric surrounding the cost containment goals and objectives of the legislation, it could lead to scarcity or rationing of healthcare delivery services. And if that happens, people may get less healthcare or be denied care in certain circumstances. And I think that concerns people. I don't think that's an irrational assertion or an irrational conclusion. So there is clearly a goal within this legislation that's pending to contain costs and to limit funding. That's going to, I don't think, by the way, the plan is going to actually do that, but that's what they're threatening to do. But if you have decisions that are going to be made that deny health care or reduce health care or provide scarcity in terms of health care, it could result in people getting less health care or different health care than they're receiving now, and it's not irrational to be concerned about that.
Let me ask you real quick about a couple other things. Government control. It seems like the American people, especially at these town halls, have seen the bank bailout, the stimulus, now health care, and this government-run option, and the president may have somewhat of a perception problem. He comes in as a Democrat, so they think big government liberal as well. Has it been too much, too fast? What is your take exactly as to what's going on?
Well, we should all just acknowledge the current healthcare delivery system is broken. We cannot sustain it on its current trajectory and platform, and so we need to find a better way to do this. But I think the mistake the president made is having the solution be the federal government taking it over.
We'll get them. Rush hour. Still low.
We all should agree that the current healthcare delivery system is broken and it needs to be improved, but that's not the same as agreeing that the federal government should take it over or step in and that we should federalize healthcare decision making. There's an honest difference of opinion by Republicans that we believe consumers and patients should be in charge of those decisions, and we should empower consumers in a marketplace to be in charge of their health care. And if they need to have some help with that financially, so be it. But to have the decision making, the power, the regulation, and ultimately a very difficult bureaucracy take over more and more of our healthcare system is not good for the country. It's not good for our economy. It's not good for healthcare. And I think President Obama just misunderstood that.
Do you think the president is somewhat obsessed with this government control issue?
You have people in the president's party and the president saying we need to have a public option to quote-unquote keep the private sector honest. Using that logic, you would then say, well, if the price of potatoes are too high, are we going to have government potato farms? If we have other staples and necessary supplies that we're concerned about, are we going to have government competitors then as the way to have a check and balance on the marketplace? That is not how the American marketplace works. It's not how private enterprise works. It's a very dangerous precedent to set, and candidly, it's a very dangerous mindset. When you have the President of the United States and the United States Congress and majority Democrats saying that we're going to create government entities to directly compete with the private sector, that is contrary to notions of private enterprise that have served this country so well throughout its history, and it's frightening to people.
Quick couple last questions. Some of these signs we've seen at the town halls, that Obama dressed as Hitler signs, some folks bring guns to rallies. I mean, does it detract? How much does that detract from the overall message that people are trying? I mean, is it hurtful to a degree?
Well, it is important that people express their views. They're going to have strong views, and to express them strongly is okay. But we need to do that in a way where we can have a dialogue and a debate. And name calling by itself isn't going to solve the problem or deal with the issue. So we need to express our feelings strongly, directly, and boldly, but we need to do that in a way that allows for a civil debate. That being said, I think it's appropriate for Republicans to stand up and fight bad ideas, and what the president is proposing is a bad idea, and I hope and pray that members of the Congress who are Republicans stay united and strong in opposing these bad ideas. I also think it's important that we have our own positive ideas, not just be the critics in chief. And there's lots of things that we could agree on in healthcare reform, such as the need for medical malpractice reform, opening up markets so people can choose to buy their insurance not just in their home state but wherever they would like, paying not for volumes of procedures but quality, and much more. So let's set aside those things that are bad ideas that Republicans understandably aren't going to agree to, and see if we can find a solution. But that's going to require the president to come to a different point than he is now.
Okay, last question. Israeli settlements. I just want to ask you real quick about that. The Obama administration has really pushed back on the Israeli government on this issue. I mean, do you see the Obama administration as a friend to Israel on this issue?
Well, the nation of Israel is a sovereign nation, and they have the right to take actions in their own interests, in their own way, for their own reasons. And the previous prime minister, now the current prime minister, had signaled that they were going to move forward with these settlements. They have done that, fulfilling that commitment. And I know President Obama may be disappointed about that, but I think that is appropriate for them to move forward with a decision they've made. It's their own decision. They're a sovereign nation. It's not the place of the United States to be micromanaging what they do and telling them what to do.
Thank you, sir.
Okay, thanks.
Governor. Appreciate it. All set.